Good evening, everyone. Welcome to another insightful session. I'm your host, Maitri, and today we have a distinguished guest with us, Dr. Tapaswini, a renowned expert in head and neck surgery.
Thanks, Maitri, for the beautiful introduction.
Our focus today is on head and neck cancer, a topic that concerns many. Dr. Tapaswini, to start, could you provide our audience with an overview of head and neck cancer?
Right, so head and neck cancers are actually a heterogeneous group of cancers which are biologically very diverse and origin from area above the clavicular bone. And the most common site of a head and neck cancer is generally the oral cancer, oral cavity, and this is the most common cancer in India. But it can origin from the nose, from the paranasal sinuses, from the pharynx, from the larynx, that is the voice box or the upper airway. The other structures which it can origin are from the thyroid glands, from the salivary gland, or structures like the skin. So depending upon the site of origin of the cancer, we label them as different anatomical areas like the oral cancers or the oropharyngeal cancers or the nasal and the paranasal sinus cancers or the thyroid or the salivary gland cancers.
That's insightful. Dr. Tapaswini, what are the common types and what are the risk factors associated with it?
There are different types of head and neck cancers, so the type also depends upon where is it originating from. But 90% of the head and neck cancers are squamous cell carcinomas. We also have adenocarcinomas when they originate from the glandular structures. If the site of origin is from the skin, then you can have basal cell carcinomas or the squamous cell carcinomas. If you have it from the thyroid gland, you can have papillary, follicular, medullary thyroids. If they origin from the salivary glands, then you can have adenoid cystic carcinomas, mucoepidermoid carcinomas. So depending upon the site of origin of the head and neck cancers, you can have various types of carcinomas. The most common risk factor for head and neck carcinomas, in fact 90% of the time, it is tobacco. 75 to 80% of the contribution comes from alcohol. The other factors are also because of excessive consumption of areca nut, which is called pan masala, which is marketed in the form of pan masala. The other factors which are contributory are one, dietary factors. So diet which is deficient in vitamins or certain minerals and selenium, zinc, iron. Certain environmental factors like excessive exposure to certain industrial pollutants or industrial factors, or exposure to diesel, sawdust, petroleum, or you can have silica, wood dust, industrial paint. All these factors are also contributory. There are certain viruses implicated like the human papilloma virus or the Epstein-Barr virus, the HIV, HSV, the herpes simplex viruses. And the excessive sunlight exposure has also been implicated, and that is in the causation of skin cancers or the lip carcinomas, exposure to ionizing and non-ionizing radiation. All these are various factors which are implicated in causation of head and neck carcinomas.
Those are crucial points. Now, let's delve into symptoms. What signs should people be aware of that might indicate the presence of head and neck cancer?
See, head and neck carcinomas can present in many different ways, depending again on the site of origin. As we said, the most common site is the oral cavity. So oral cancers generally would present either as an abnormal growth or a non-healing ulcer. You can also have abnormal loosening of dentition, or there could be abnormal oral bleed, halitosis, decreased mouth opening, difficulty in swallowing, or abnormalities in speech. And the other, if the site of origin is from the larynx or from the hypopharynx, you can have difficulty in vocalizing, or there would be difficulty in swallowing. So the symptoms would definitely depend upon where is it originating from. Like nasal cavity cancers will present as nasal obstruction, or you can have nasal bleed, or you can have chronic sinusitis. But what we should remember is any symptom which lasts for more than 3 to 4 weeks does warrant an attention, and not responding to any sort of a conservative management means that the patient should visit a specialist.
Absolutely, Dr. Tapaswini. Now, moving on to diagnosis and treatment. How is head and neck cancer diagnosed, and what are the available treatment options?
See, diagnosis is always made from the histology, histopathology, which means a biopsy is mandatory in all cancers. But then to look into the extent of the cancer, the other way that we do is image them. Imaging is another, which is an additional information that you get about the extent of spread of the cancer. So either we image them with a CT or with an MRI, or if you have an advanced carcinoma, the imaging is done in the form of a PET scan. So all these are various modalities which actually, when we collaborate all the information together, we land up with a particular diagnosis of that particular patient.
Important information, Dr. Tapaswini. Let's discuss the emotional aspect. A cancer diagnosis is not only a physical challenge but also a mental and emotional one. How do you support patients and their families through this journey?
Correct. I mean, the question is very apt, because head and neck is an area which does produce a lot of emotional upheaval in all the patients, particularly because this is a site which cannot be hidden, and this is always an exposed part of the body. So anything that we do in the head and neck area, the treatment always manifests, the treatment always has some repercussions, because there would be some amount of disfigurement, there could be some difficulty in speech, or there would be some difficulty in swallowing. Not that every patient has, but yes, these are certain things which the patient should be prepared with whenever there is a head and neck cancer. So all these patients require what we call as an holistic approach, where we look into the emotional, physical, social, and also the spiritual aspect of these individuals. So what we do is we do a lot of counseling of these patients and also their caregivers, where we include all these aspects which I have talked about. So it is a detailed counseling where we look into the expectations and also the anticipations of the patient and their caregivers. We allay down their fear, their anxiety. We look into their emotional aspect. We look into how would they be able to fight against that particular disease. So emotional outbursts of the patient, we actually support them by giving them a lot of positive inputs. So that's how we help them to come up and also help them to tide over this crisis and fight this particular disease.
Well said, Dr. Tapaswini. As we wrap up, what message would you like to leave our audience with regarding head and neck cancer awareness and prevention?
Right. So head and neck cancer, as we see, is primarily a lifestyle-based disease. As we said, 90% of them are tobacco-induced and 75 to 80% of them are alcohol. So what does it actually mean? If we change our habits, if we do not engage ourselves in these habits to a great extent, we can be away from these cancers. The second is look into our nutritional and our dietary aspects. So the more closer we are to the nature, which means the more green we are and colorful we are in our diets, we would remain protected. So that's going to give us a rich amount of antioxidants, vitamins, micronutrients, which help our body to ward off these diseases. And the third thing which I would love to share with my audience is physical activity. It's extremely important that we exercise regularly every day for at least a period of 30 minutes. And last but not the least, to have a positive attitude towards life. Thank you so much.
Thank you, Dr. Tapaswini, for sharing your expertise with us today. And thank you to our audience for joining us. Remember, knowledge is a powerful tool in the fight against cancer. Until next time, stay healthy, stay informed.
Thank you. Thank you so much.
Goodbye, everyone.